Good afternoon. Thank you for your time today. I'm Caroline Landon, Director General for Health and Community Services, and I would like to introduce my colleagues, Rose Naylor, our Chief Nurse, and Patrick Armstrong, our Medical Director. Alongside me and other senior colleagues, they are leading Jersey's response to the developing coronavirus situation, ensuring our preparedness at a clinical and practical level, and that we are able to protect our island's most vulnerable residents. We want to use this opportunity to keep you updated and informed on what's happening within this fast-moving situation. You will be aware from advice issued over the weekend that our main aim is to continue to flatten the curve or flatten the wave of the coronavirus epidemic. It is essential that we do this if we are going to contain the spread of coronavirus within our island as far as possible. Flattening the wave means, and you will be familiar with this by now, not seeking to stop the epidemic because we can't do that, but to stretch it out. Doing so will help as far as possible reduce demand on our hospital services and give us the best chance to save more lives. In effect, we are attempting to stretch out the duration of the virus on our island so that while the same number of islanders may be infected, we will be better placed to look after those who are seriously ill at any one time. This will help us to save more lives. Fewer will suffer severe consequences, fewer will die. It can be easy to look at how coronavirus is progressing in other countries and wonder why we are not handling our preparations in a similar fashion. The reason is that compared to the UK, we are behind the curve, and we can learn from this and prepare for it. If we were to take proactive steps too early, for example requiring the compulsory isolation of certain age groups, then we risk fatigue setting in, meaning that islanders will not observe restrictions when we most need them to. I want to reassure islanders that we have been prepping for this since the first cases in Wuhan, China. We have stood up our Silver and Gold Command, we are reviewing our business continuity plans on a daily basis, and we have our coronavirus hub at the hospital live and staffed by medical experts. I also want to take this opportunity to pay tribute to my GP colleagues. They have worked exceptionally hard over the weekend to contact patients so that those aged over 80 and vulnerable people can have a free check to ensure that they are in the best possible health and have all the medicines they need. We continue to review our business day by day within Health and Community Services. We are moving to preparedness for COVID-19, and we'd ask all patients to follow our advice as and when it is updated. As the week progresses, we will be changing appointments for islanders, but we will be making contact with you to let you know. Today we have temporarily closed our 3 day centres for the over 65s, and our staff who run them are being redeployed. The League of Friends and the Time Out Cafe are also closed. We are also reviewing all our appointments for the over 65s to see if they need to attend the hospital or could be managed differently. Specifically, we would ask that people over 65 feeling unwell should not visit any of our health premises except in emergencies. If as the week progresses this changes, we'll make contact and let you know. Regarding travel, we'd reassure islanders that travel to the UK for medical purposes is currently classified as essential travel, and therefore these journeys and medical transfers are not affected. I am confident that we can respond as a compassionate and supportive island community, and we can save more lives. This is where you can help us. We need all islanders to be sensible and responsible and follow the advice issued by the Government of Jersey over the weekend. We need islanders aged 65 and over to actively practice social distancing. This is the single most important thing everyone can do to help us deal with the days ahead. Everyone has a part to play, whether they are over or under 65. We all need to support the most vulnerable in our society. This is really important. This will save lives. We cannot stress it enough. You can make a huge difference. We need those who haven't been to an affected country but may be exhibiting signs of flu to self-isolate for at least 7 days after these symptoms end. Please do not call the helpline in this situation unless your health severely worsens. And we need you all to remain calm, practice good self-care and prioritise your mental health. This is a worrying time for many, and speculating on social media or other forums will only raise anxiety. As was announced this morning, we have 5 positive cases of coronavirus in Jersey. We know that all the patients are well and are self-isolating at home. They have all returned from an affected country, and as far as we are aware, at this time, there is no case of transmission within the island. As I said earlier, this is a fast-moving situation, and we will endeavour to ensure the media and public are supplied with as much information and advice that we can provide, but only based on the appropriate medical evidence. We will continue to base all our decisions on the most up-to-date modelling available. Our approach to the coronavirus pandemic is and must remain health-led. Thank you for taking the time to listen to this statement. My colleagues Rose and Patrick will now take questions.
One of the questions that we sort of keep getting asked is why we're sort of slightly different to everyone else. It's sort of addressed in your opening speech then, but why are we different to some of the more serious locations like Italy, Spain, or even why are we different to somewhere less serious but of a similar sort of demographic and a similar size like Guernsey? Can you just sort of explain that again, please?
One of the most important things is to understand the stage of the process that we're at. So we're all at different stages, we're all affected differently, and it also is around the resources that we have, the approach, the skills that we have. So there will be subtle differences, but we're all learning from each other all the time. So things change on a day-to-day basis.
And in that sort of scenario, what is the danger, maybe the wrong word, but what is the risk of moving to an Italy-style scenario or some other sort of scenario in terms of lockdown too early?
Every decision that we take has consequences. So, for example, if we lock down the island, that may have an effect on workforce. Just be one example, but what we learn all the time is everything we ask for has an effect across government, across the island. So we have to be really careful and really considered in every response that we make, every decision that we make, and all the advice that we give.
And more pertinently, we need islanders to adhere to the advice that has been given over the weekend. So the advice that is out there now is the advice that we really need you to adhere to. We cannot stress how important it is for us as an island, for islanders to follow those instructions.
I would absolutely second that. It is the single most important thing that we can do. It probably feels for people as an individual that they don't really feel it, but it has such an impact. It will help us so much in the days to come on how we manage this across our health system.
Fiona Potney, Bailiwick Express. I understand previously it's been discussed the idea, obviously a lot in the UK, of herd immunity, or as we've heard in Jersey, island immunity. Is that still the policy being worked towards, and if so, can you provide a bit more detail on that and what that actually means for islanders?
So, as we've just said, we have 5 cases of coronavirus on the island. So the virus is here. We can't stop it from coming to the island. What island or herd immunity means is that as people suffer from the virus, and we know for a lot of people, probably around 30% of people, they won't even know that they've had it. Some people will have milder symptoms, but as those people have those symptoms, they will develop immunity, and that means they will be hopefully protected in the future, and that means the rate of transmission from one individual to another will slow.
So to clarify, that's a desired outcome from the island's health service that we want it to spread, albeit in a kind of managed way?
It's an inevitable consequences of where we are now. You will not stop the virus from spreading, and yes, ultimately we need the island to develop immunity to the virus, but it has to be in a very controlled way.
And, sorry, just another question on that. And how does that fit in with, I know there's been some discussion in the UK over whether that's the right policy. I know there have been some World Health Organization officials who've raised questions about that policy, and indeed the Chief Science Advisor, Sir Patrick Vallance in the UK, has also faced questions over that. So why is it that we are following this policy?
Well, as I say, we don't really have an option on following it. It's here on the island. We can't stop it from getting to the island, so the virus will spread over a period of time. We can't stop that, but what we're trying to do is control that spread, and Caroline's talked about flattening the curve. That's what we need to do here, and that's what we need to focus on.
Can you tell me Jersey's capacity for testing and exactly who is being tested?
We're getting some technical questions that are outside my expertise as an orthopaedic surgeon. However, in terms of testing, what we do with any condition is we test according to the symptoms and signs that people present with. Currently, the advice that we're following for that testing is based on advice from my colleague, or my consultant microbiologist, and our medical officer for health, Dr. Ivan Muscat.
And how long are these results taking to come back as well?
So this is a new virus, so at the current time we have to send the tests off to a UK laboratory, and it takes about 48 hours for us to get the result. That is the same for anybody anywhere.
You mentioned the importance of people's mental health at this time. What measures are you taking to make sure that people are staying mentally well?
So, from a point of view of our workforce, we have got a range of measures in place, particularly focusing on staff wellbeing. So we've already put some general messaging out about making sure that you take care of yourself during this time, so that you take breaks, you make sure you're hydrated, you eat during your shifts, but also that you take appropriate rest between shifts at work as well. And then in terms of the wider workforce, we're working with partners across services in terms of the support we can provide to islanders to reduce people's levels of anxiety and support those most vulnerable when they need additional support as well.
And we have access to the listening lounge, which I think we've talked about in earlier briefings for islanders who are feeling concerned, worried, anxious, and of course you can also phone the helpline.
Hi, again. You mentioned earlier the dedicated hub at the hospital that's being set up. I think that was briefly mentioned, the epidemic room, at a previous briefing. Could you provide some more detail on the additional preparations that have gone in for that, and what's it looking like at the moment? What size is it? How many beds?
I'm going to ask Rose as our exec lead.
So the hub that we have based at the hospital at the moment has various cells, as we call it. So there is a whole cell that's dedicated to workforce, which, as you can imagine, is one of our most precious resources at this particular time. So we've got a team of staff in there working with lots of different professional groups and care workers across the community to make sure we're very clear on our need in terms of service provision, but also we're using people perhaps in different ways moving forward to continue to support frontline services whilst we deal with what's to come in the future. So a lot of the work they're doing at the moment is around preparation. It's around making sure we understand exactly who we have on the island, what skills those people have, if any of our staff have any health risks themselves that we need to be aware of. So we've got clear plans then about how we redeploy people differently as the days and months come ahead. Also, in addition to that, we've got 2 other rooms, one where we meet on a very regular basis, and that's really a tactical meeting, which is about how we manage our services each and every day. So that's about making sure we're very clear about our whole estate and our patient activity, as well as our staff activity. And that includes things like our supplies, as well as our actual bed occupancy at any one time. And then we have had a team also supporting the health helpline based down there. They've now been co-located to a different location with customer and local services, so we've got a much bigger team now supporting the helpline.
And in terms of the medical equipment available, would you be able to provide us an update on respiratory equipment for very severe illnesses, the kind of amount that you have currently, and anything else that is being ordered in response to this health emergency specifically?
So I think we've talked in quite detail around our ventilator capacity, and we are confident that as of now we are working to ensure that we have robust plans in place to ensure that we're able to service our needs in ITU, but it is going to be challenging.
It's not just about equipment, it's about staff. What we're doing is making absolutely sure as many of our staff are as well trained as possible, where we're providing time, resource for people to become as prepared as they can to manage to care for the people that we're expecting to come into our hospital.
We've said it a few times, just to clarify what the policy is in terms of testing.
I would have to refer you. I don't want to confuse the issue we would have to get back to you on that.
Ms. Landon, I think you said, did you say there was tier 1 and then tier 2?
Yeah, so people who have come back from tier 1 and tier 2 countries, and people who are exhibiting symptoms from those visits.
Is there a particular theory as to why it's just that at the moment? Because, I mean, you sort of said people are going to get it. Is the theory that we're only trying to test the tier 1 and tier 2 and vulnerable people because of the volume we anticipate could get the virus, if that makes sense?
I think it's getting back to what I said. We don't test everybody for everything as they come through. You have to focus your testing on those who you think most need it. Otherwise, with any condition, you could do endless numbers of tests, and that would be pointless.
So with regards to those who come back from tier 1 countries, for example, so we saw the flight from Tenerife last night who were told to go immediately into self-isolation. What checks are being done on them to ensure that they are definitely adhering to the advice, and what contact is the health department having with them generally? Is that an ongoing daily basis kind of thing, or is it just that we're trusting that they will adhere to that advice?
So, and this is what I'm trying to emphasise with all the recommendations. They are recommendations. They are not enforceable recommendations. And we would hope that we would not have to, in our island community, make them enforceable. Abiding by these measures will save lives. So the flight from Tenerife was escorted safely back to people's homes, and any of those passengers of that flight that exhibit symptoms are able to access support.
Apologies if I've just missed this, but has there been a site for extra hospital beds specified at all?
Sorry, has there been
a site kind of identified for extra hospital beds for extra capacity if needs be?
So, as you can imagine, we have looked across our economy to see where we can flex capacity if required. And we have identified a number of sites which would be able to help us should we need to decant.
Where are they?
They're part of our business continuity plan, and I think to reveal those sites at the moment would be unhelpful. But if we do need to use them, be assured that we would share that information.
Is there preparation going into those then?
There's preparation in our business continuity plans to ensure that if we do need to decant, then we will be able to do so effectively.
Are you able to specify how many additional beds that would entail in terms of looking at these other sites?
I think we're looking at multiple scenarios, so it would be unfair of me to give you any specific numbers. As part of our modelling work, we are looking at all eventualities, but the information changes on a daily basis. It's not a virus that I'm able to give you with any certainty numbers around requirements, but what we do have is modelling assumptions that we're working to and flexing around.
Going back to the tier 1 and tier 2 testing and people coming from certain countries, are you considering matching Guernsey's kind of quarantine procedures in which they're looking at anyone entering the island to self-isolate? Is that something that could happen in the future?
So I think as we progress, recommendations will change. As you have seen, advice has changed over the last week, and I think that will continue as we continue to respond to both the modelling assumptions and both to presentations on the island. What we're not doing is making decisions that are not based upon information. We're really clear around looking at our modelling, making it Jersey specific, understanding our own island identity around our population so that we can give the best possible response. So it may feel like we are not responding every day in the way you would want to, but it's why I ask that people don't speculate. Please be assured that we are using the best possible sources of information to ensure that we provide the best possible response we can for islanders.
On the topic of the day centres that have temporarily closed, are you able to tell us what support's being given to those that aren't able to access those anymore? Because naturally they are a very well used and important facility for plenty of members of the community.
So we recognise that this has come at very short notice for people, and I can assure islanders we've had our staff in over the weekend to make sure that everybody's been contacted who is going to use those services today and into the rest of the week. The teams that normally work at those day services are looking at how they can support people differently and make sure we still have a lifeline to those individuals as well. So again, that's something that we started work on over the weekend, which they'd already been planning for, but have now put into action.
Just a point on, so it's advice at the moment in terms of the travel advice. Would there be a point where we could move to an actual ban that you're aware of?
I think the advice will change. Whether we would actually move to prohibiting movement is something that is a decision that needs to be taken politically.
And just from me, we talked a lot about what other places are doing and how you want to kind of make it a Jersey central reaction. But in terms of advice using masks, some people might have seen people wearing masks around the island. Would you recommend that as a precaution, or is it something that you're not commenting on?
I think it's something we probably best not comment on. I don't think it will do anybody any harm by wearing a mask.
Sorry.
One more. There's always one.
One of the things that I asked on Friday, but I didn't really get clarity on, was around sort of staffing levels and things like that. One of the things Richard Breniff said was that civil servants will be brought in to fill in hospital roles. Can you just sort of explain to me exactly what kind of capacity they're going to be in, what sort of roles, and how that works?
Yes, so what we're doing at the moment is we've cancelled a lot of our training that we normally provide, and that's enabled us to redirect our training prioritisation so that we make sure staff are ready to deal with the presenting patients as they come through the hospital, and we're stress testing our business continuity plans. Sitting behind that then, as we start to shift staff into different roles, we are bringing other people into jobs. So this could be in relation to managing staff accommodation and how we support staff who've been on shift when we see more cases presenting, so where they stay. It's also about supporting us with some of our plans around when new staff come into the island at short notice and how we support them from an arrival point of view. Well, there's a whole range of things that we're doing that across government, civil servants are helping us and supporting us to make sure we've got some good measures in place ready when those eventualities arise. So that could be around legislation changes, specifically in relation to our reaction to the COVID, and other examples like that where they're giving us support.
Thank you.
Thank you very much. Thank you. Thanks, everybody. Thank you, panel.
Thank you.
Ms. Landon, I just wanted to check something you said in your statement about over 65s. I think you said we're advised not to go to health premises.